COVID-19 pandemic may be mostly contained, but we're still discovering some of the impact it's had on us. The World Health Organization is concerned about the impact on the management of other health risks, other communicable diseases like malaria and tuberculosis. In fact, it expects deaths from non-communicable diseases to increase by 17% over the next 10 years, and that number is even higher for our continent, Africa, where the WHO is expecting a 27% increase in such diseases. Well, let's unpack this now with Chris von Straten, the Global Health Advisor for Clinical Governance at International SOS. Chris, good afternoon. Thank you very much for your time. I guess there was no escaping this as the world galvanized and mobilized every bit of its resource to fight the pandemic.
Yes, Dan, thank you very much for allowing me on the call. And yes, the world has been so focused on COVID-19, and we had to make some great advancements and strides with the vaccines, understanding this pathogen and putting measures in place. But what I think is happening, and has happened because of our focus on COVID, we've kind of been a bit distracted from the other chronic conditions like diabetes, like hypertension, that if poorly controlled can cause serious disease and health problems. And we're seeing a spike in those numbers. And it's partly because people have not been as active, but also the pandemic.
Yeah, I mean, I've spoken before to the likes of Goodbye Malaria and about how that their programs have been affected. Just as one example, you've mentioned diabetes, and of course we've been dealing with a rise here in South Africa as well with mental health awareness. So what risks now, I mean, are there for the continent because of what you've just expressed?
Yes, Dan, I think the risks are real. And as you said at the very beginning, it's things like malaria. We're seeing some of those numbers go up because perhaps people couldn't get the right preventative measures like mosquito nets or treatment. And in some areas, we've even seen TB going up again. And that's worrying because we were beating it before the pandemic. And then the NCDs, certainly also a problem because of, let's say, a lifestyle where you're not exercising as much as you used to, or where you're not getting the nutrition and food that you need to be healthy and strong.
Now, how can we, communities, I mean, how can they begin to resume, for example, access to some of those facilities? Because some of the programs were stopped because there was lockdowns, for example, and then people lost the rhythm or the habit of accessing services. Some of the services have to be refinanced, have to be refunded, for example.
Exactly, Dan. So the funding in some instances had to be orientated towards the COVID and COVID pandemic. But the good news too is it's not all doom and gloom. There are very smart individuals able to do the maths and figure out where can we spend the money so that we get the maximum impact. And it's really about cooperation. First, you've got to measure it. If you can't measure something, you can't improve it. But once you've got an idea of where the problems are, we can then focus there with government, with private, with that community support, and really try and drive a difference in beating COVID, but also beating and making sure that we don't, malaria, TB, and the NCDs don't get the better of us.
Yeah, should Africa fast track and embrace more technology here? Could be using it a little bit more. I mean, during COVID-19, we've been working remotely, for example, virtually, and we've learned quite a bit about that. Should the health sector, when it looks at these challenges you've just expressed, especially the rise of non-communicable diseases in Africa, use more and more technology going forward to alleviate some of the pressure and address some of the challenges?
I really hope so, and I really believe so. It's one of my passions, and it's interesting. I studied telemedicine before the pandemic, and for me it was always, yes, this is going to be the future. It's the future of finance, it's the future of medicine, and now with the pandemic, it's really pushed telemedicine and supporting remote communities, helping them manage their malaria cases, and something we do daily for our clients in Africa. And it's something I'm involved with daily, is the review and management of malaria cases. So I'm actually really excited about I'm thinking just on my arm, I've got a watch that can measure my saturation. And if you've got COVID, that's important. You can also get a digital blood pressure measure, and they're not expensive anymore. The same with the blood pressure test. So yes, I think it's really important. It's actually really exciting what is already being done, and I think we will be able to do over the next couple of years.
Yeah, as we're about to conclude, Chris, I mean, not only the situation of non-communicable diseases has been compounded by the focus that had no choice but to effect on COVID-19 over the last 2 years on our continent. We're still dealing with armed conflicts. I mean, in the Sahel region, you know, right from the western part of Africa across to the Horn of Africa, Somalia, Ethiopia, and even here in southern Africa, I mean, northern parts of Mozambique, in Cabo Delgado, there's been a conflict going on there since 2017. I mean, those kind of factors, they also do influence how you're dealing with disease. I mean, if there was something that you'd be thinking about, how can it assist, or ideas, what to do, I mean, what would the message be now? Because you're dealing with a post-COVID world, you're dealing with still existing armed conflict. Just yesterday, we were speaking about the amount of people who go to bed hungry, who skip a meal in Africa. 346 million people.
Yeah, Dan, it's a big problem, and I think, and it can be cliched to say it, but Ubuntu, it's what Nelson Mandela spoke about, it's what Desmond Tutu spoke about. And the point I want to focus on here is, unless if I just look after me, then at the end of the day, I'm going to suffer. And it's, for example, I got vaccinated to protect me, my family, my loved ones, and also people at risk. So that's my neighbor. And if you look at global warming and the global challenges we have, which include conflict, we're only really going to solve it if it's together, in a partnership, for that end objective where we are mutually looking after each other. So I think that's really key, and we've got to keep driving that message.
Thank you very much. Chris van Straten, the Global Health Advisor for Clinical Governance at International SOS, sharing some of his views on this World Health Day.